Hi there, I'm Dr. Stephen Phelan. Welcome to this short little video. I'm really excited today to bring you this video and announce a new event that I'm creating. And it's been something I've been thinking about doing for a number of years, but other events and projects have kind of gotten in the way. And now, at this point in time, I have the event locked in. It's ready to go. And basically, the source of putting this event together is I've been really fortunate over the years, the last number of years in my practice, to receive referrals from other dentists of some tremendous patients that I've been able to help and treat. Really interesting cases, lots of really great people. And what I wanted to do is put together an event that's basically a thank you to all of you dentists out there that have referred me patients, as well as all of the dentists that I've treated personally in my practice, because I've had a number of dentists that have come into the practice that I've treated. And then lastly, I also wanted to make this an opportunity to meet some of the Occlusion Design members that are more local to the GTA. So what we're doing is I'm putting together a free event. It's an evening seminar, and we're going to have this seminar on Thursday, February 7th from 6:30 to 9:30, 10 o'clock that night. And it's going to be hosted at the OE Banquet Center or Banquet Hall in Oakville, and that's on 2245 Spears Road. Very easy to get to, tons of parking, really great facility that I've gone and looked at, and one of my patients who's a good friend of mine runs the facility or helps run the facility, and I'm really excited to use that facility for this event. We're basically going to have an evening lecture. The lecture is something I'm putting together now that's a topic that I haven't really presented as a formal topic before. I've talked about different parts of it, but basically the topic's going to be how to manage a hopeless incisor. And we're also going to give you a really great catered dinner. So you're going to have a catered dinner. We're going to have some nice wine, and I'm going to speak for about an hour and a half to 2 hours, enough to get you or allow you to receive 2 CE points. I'm going to speak for about 2 hours, showing you some really interesting cases that I've taken from the tooth being determined to be hopeless, all the way through extraction and grafting the site of the tooth that needs to be replaced, and then talk about strategies for placing a dental implant and then restoring the dental implant. So it's going to be a pretty comprehensive program, from diagnosis of the tooth needing extraction all the way to the restoration of the tooth with a dental implant. I'm going to talk a little bit about replacing a hopeless incisor with a bridge, with a Pontic as well, but the focus of the event will be mostly on extraction site grafting and replacing the tooth with a dental implant. That'll be the focus. And I have so many great cases for this topic. I did write a blog series on one of these cases, and I'm going to be sharing with you this case in detail. And then I have a couple of other cases. I have this case right here. This case, the patient came into me. It was a trauma case. This is typically what happens, is it's some kind of trauma that causes the tooth to be hopeless. And I took the case from extraction of the fractured remaining root structure to grafting the socket, to placing the implant, to creating a custom provisional to manipulate the tissue and basically make the tissue as good as possible for the final restorative treatment. And then all the way to just last month, placing the final crown for this patient. And I have a number of these cases with different variances and nuances of each case, just some different things that we did with the grafting. There's a number of different grafting techniques. It's almost a confusing area in dentistry because there's so many different membranes, materials, techniques. I'll tell you a lot of different techniques work, but what I'll do is I'll share with you what's working for us in our practice. Because I've used a number of things that I don't really think I would do again as far as materials go. for grafting, and I'm going to share with you what's working, and then share with you what's working restoratively. And so I think it's going to be a tremendous lecture. I'm really looking forward to putting it together. As I said, I have some great cases, and I want to basically do this as a thank you to all of you that are, again, referring doctors, dentists that I've treated over the years, and then my Occlusion Design members. And what I'll tell you is my Occlusion Design members span the world. You know, we have members everywhere from Canada and locally in the GTA, all the way to Mongolia and Indonesia and Abu Dhabi and Australia. And I don't expect those of you that are, you know, going to have to fly in for an evening lecture and dinner. You're more than welcome to if you'd like to, but I don't expect you would. You know, if you'd really like to come to Toronto, why don't you come to my spring seminar, which we're giving you as your bonus for joining Occlusion Design. I think you'll get more out of that, and we'll have an opportunity to spend some time together then. But what we're going to do is we're going to record the seminar, the presentation, how to manage a hopeless incisor in high definition, really well, you know, really record it really well. And I'm going to post that to the Occlusion Design site. So those of you that are not local, don't worry, you'll miss the dinner, but I don't know that you want to fly all this way for the dinner when we're going to be able to get together in April anyway. You'll miss the dinner, but you'll be able to see the content. You'll be able to receive the information, the lecture. I'm going to videotape it, post it to the Occlusion Design site, and as always, there'll be a section underneath. You can ask me any questions you'd like about the topic, because it's not really a topic I've covered in Occlusion Design too much. It's a topic that I think is important in dentistry because, you know, you take out the tooth, you don't do any kind of grafting, you can often have a very bad defect, especially if the patient's missing the buccal plate to begin with, or the majority of patients out there, as we know, are missing or have a very thin buccal plate. So the bundle bone will resorb, they'll have no buccal plate when it's all said and done. So this is going to give you some strategies to really help your patients with thinner buccal plates or thinner biotype to really not lose a lot of their tissue volume and create huge defects and aesthetic nightmares down the road. So great presentation, I feel. Some information I would have loved to have had, you know, 5 years ago before I went on my journey of learning a lot of implant dentistry, surgical phase of implant dentistry. Again, great dinner, having some wine. It's all really good. I'm really excited about the evening. Basically, below this video, this is going to be on a web page on my Phelan Dental Seminars site. Below the video will be a registration form. If you're one of the 3 classifications of dentists, you know, a referring doctor, a dentist I've treated, or an Occlusion Design member, if you'd like to attend this event, sign up using the registration form below. Again, it's completely free. It's my thank you to you for supporting me throughout the years. And if you're not one of those dentists, if you're somebody who's thought about referring to us, we also have our referral form on this page. So you can print out the referral form and by all means refer us an interesting patient. We're mostly looking for patients that need a reconstructive type of dentistry, aesthetic dentistry like a veneer case, or people that need dental implants. And with dental implants, if you'd like, I can, you know, we'll talk about this more in the lecture, but I can get the patient to the point where they have their provisional, and then you could carry on and complete the restorative therapy. So we're looking for those kind of patients. We're not really looking for somebody who needs a single crown. Although a single anterior crown, if you feel uncomfortable treating that particular patient, if they're very picky, I'll treat that patient, but we're gonna have to charge them a fair amount for a single anterior crown just because of the complexity of doing that, just so they're aware of that. But we're looking for, you know, different types of complex wear cases, different types of reconstructive cases. That's what we're mostly referred to my practice. anesthetic cases. So if you'd like, by all means, print out the referral form, refer us a patient, and sign up for the seminar as well. We'd love to have you join us for this event. If everybody really likes this event, I'm going to host it again. I'd like to host this about every 9 months if it's a hit, if people like the forum and the opportunity to get together, have a nice dinner, earn some CE points, and hear about an interesting topic. So again, the information on the banquet hall is here on this webpage. The referral forms are here on this webpage, and your opportunity to register for the seminar is also here on the webpage. Please don't register if you're not going to attend, because we do have to order a meal for everybody, and we're having in a really great caterer to do this. So I don't want a lot of wasted food. You know, that's not good for anyone. So if you're going to attend, if you can't attend, obviously tell us within a few days before the event. We'll probably send out a reminder email to everybody that registers just to make sure they're still attending before we have to commit our numbers to the caterer, because nobody wants to waste food, especially when there's so many people without throughout the world. So again, great event, I feel. I'm really looking forward to getting together with everyone and expressing my thank you for being part of our community and supporting me in my practice and my online continuing education efforts. So thanks again, and if you have any questions, feel free to email us, and we'll talk to you soon. Take care.